Hey, it's Dr. Braddock here, and really what I'm going to talk about in this video is probably one of the most important things because it's actually the essence of what goes on in our office. It's what's grown our office to the level that it's at, and it's what gets us such amazing results. Really, we have to understand how the body was designed to heal and function. Whenever you can take 2 half cells and in 9 months have 40 trillion cells, you have a beautiful, miraculous body, you have to understand that didn't happen by accident. That a doctor didn't have to do that we didn't create it in a test tube, that your body has an innate intelligence, an inborn, God-breathed intelligence, which is really the essence of how our body is designed to heal and function. Now, a lot of times we start to look at things mechanistically, like a car, what part's broken down and then how do we replace or fix that part. But when your body was designed, it was designed vitalistically. It was designed all as one continuous thing, that each part of your body relates to another part of your body, and really that's how we approach things, or that's our perspective here in this office. Now, anytime that there is a misalignment in your spine, where a bone moves out of position, or where 2 joints become fixated, there's no more motion and things are stuck, 2 things are going to happen. The first thing is it's going to start to put pressure or tension on a muscle. Okay, your bone moves out of position, the muscles are going to grab that bone and try to pull it back into place, so we get spasm. The other thing is the muscles are going to spasm around that area to naturally splint it, to protect it, to keep it from getting worse. A lot of times people come to the office and say, well, I don't think there's anything you could do because it's a muscle problem. Let me let you know, there's no place in your body that a muscle can attach other than a bone. It's nowhere else. So anytime that a bone is out of place, it's going to affect the muscles, and you're going to have some sort of a muscular response. Now, a lot of times, our first train of thought is to take an anti-inflammatory or take Advil or something like that. But when you have a low fuel light come on in your car, if you're like me, you hate to see it. I hate to see my low fuel light come on, but it's a positive thing because it lets me know there's a problem in the future. Unless I take care of this, I'm going to be stranded. I'm going to be walking. Same thing, if there's a muscle spasm, it's basically a red flag. It's your low fuel light. It's your body saying, hey, something's going on. We're trying to do our best to protect it, but you need to address it. So that's the first thing that happens when we have fixation or a misaligned vertebra in your spine. Now the second thing, and maybe the most important, is the fact that it's going to put pressure on a nerve. Now depending on where that nerve goes to is to what sort of results that we get. Eventually we may get some sort of symptoms like headaches or migraines. Maybe it's a nerve that goes to your stomach and we're producing too much stomach acid, so where you have an acid reflux or you're having digestive problems. Maybe it's the nerve that goes down the back of your leg and you have sciatica. There's really, it could be a number of different things. It could be a pain sort of symptom, or it could be a visceral symptom like menstrual problems or digestive problems. The fact that you have to understand is that doesn't happen first. Okay, if we quit watering a plant, it doesn't die overnight. It slowly, over time, begins to get dry and brittle and wither until eventually the plant moves to sicker and sicker and sicker and then dies. But it doesn't die overnight. So as the body starts to have a lack of nerve impulse, as those bones have been moved out of place, they put pressure on the nerves, over time we start to move and get sicker and sicker. But it doesn't happen overnight. Our goal is to address those subluxations, those misalignments, where your body's no longer moving. If you look at us over time, we start in a C-shaped position as an infant, and then as we grow and we mature, we become healthy and vibrant and vigorous people. Kind of a common denominator. If you look at whether it's a professional athlete or you look at successful people or the people that we would consider healthy, they all sit upright. And whether we like it or not, we judge a lot of books by their cover. When we look at those people, we have a feeling of health, that person is a healthy, vibrant person. Over time, as people's postures start to slump and we're like this, people are at the computer all day, when you see somebody like this, it's not all that attractive, and you don't have a feeling that that's a very healthy person. And as a matter of fact, that most of those people, as they age over time and things kind of continue to get worse and worse, you see their health decline along with it. However, if you look at some of my older patients who still have really terrific posture, they stand upright, they work every day, their health is amazing. So it is all tied to posture, all tied to the way that your spine is designed to move and to function, and that's really our goal in the office. It's great if we alleviate your symptom. It's great if we get rid of your headaches or your low back pain. That's one of the things that's made us famous, but you really have to go a step farther and understand that with each adjustment, we're affecting the physiology of your body. and we're allowing you to stand up in a more vibrant posture, allowing your lungs to inhale more, to bring in more oxygen, to perfuse your tissues, and overall your body's going to move towards a higher level of health. So remember that the next time you lay on the table. I'm not a mechanic. We're just making your body a more vitalistic masterpiece that it was created to in the first place. We're getting out of the way, removing the interference, and allowing your body to heal and function the way it was designed. And really, I can't think of anything closer to health than that.